Good morning. I'm Mark Russell and I am the Chief Executive of the Children's Society, and I have the privilege of welcoming you to this important webinar this morning to launch this new Missing Children benchmarking tool. I'm so grateful to you for joining us today, and we're thrilled that so many people have signed up to join this webinar. We've colleagues from the police, from Children's Social Care, the NHS, and colleagues from various children's homes and children's services. Colleagues, we're living in the most demanding and difficult time. And this pandemic has impacted all of our lives and the lives of the young people that we work with. But you know and I know that the pandemic has impacted the most vulnerable people in our society the most. And this has been a particularly tough time for the most vulnerable young people and children in our society. Children living in poverty or inadequate housing, others battling mental health issues, and too many children are facing abuse, neglect or exploitation. And every one of you on this call is working tirelessly to help those young people. And I want to say thank you so much for all that you're doing. Your work is so important, and I know you're pressed for time, and so your interest in this new benchmarking tool and being on this webinar today is so important. For 140 years, the Children's Society has been working with the most disadvantaged children and vulnerable young people in this country. And we've been working to support young people who've been missing as well for many, many years. And in the autumn, we worked with police forces across the country to launch our Look Closer campaign, which encouraged members of the public to recognise the signs of when children could be missing or at risk of exploitation and to report that to the police, and a significant uptake around the country, which was really important. And you know and I know that children go missing for many different reasons. And the work to develop this tool has drawn on the wisdom and the experience of the frontline practitioners in the Children's Society, many of whom are on this call, and I'm really proud of every one of them. And this work also draws on evidence that we gathered from our research and policy team in the First Step report, and that report was commissioned by the PCC in Norfolk and funded by the Home Office. And we've also developed this tool in partnership with our friends at the NWG Network, and this work draws on their extensive experience and wisdom in this space, and we're really grateful to them. This tool aims to support local safeguarding partnerships and other multi-agency groups to think holistically about how we respond to children and young people who go missing from home or from care. The tool is designed to ensure that no child falls through the gaps, that by encouraging different agencies to work better together and communicate better together with each other, we can help support children who go missing even better. I'm really proud of our team here at the Children's Society for all the work that they've put into this. And I also want to say thank you to our friends at NWG Network for all that they've invested in this important project too. We hope that this tool that we will launch today will bring about real change nationally and help improve our response to missing children and exploited children. It's my absolute pleasure now to introduce my colleague Hannah, who will tell you more about this new benchmarking tool. Thank you for joining us.
Thank you, Mark, for such a great introduction, and good morning, everyone. Thank you so much for joining. As Mark said, it's just so brilliant to see so many of you taking an interest in the tool that we're going to launch today. So my name is Hannah Chetwynd, and I work as a policy officer here at the Children's Society. And some of my work focuses on children and young people who have been missing or those who might be at risk of going missing. So I'm just going to talk to you today for about 15 minutes to give you a quick background to how the tool came about. And I'm also going to show you a short video with some information on how you can best use the tool in your local areas. So just a tiny bit of sort of Teams housekeeping first. Please put any questions that you've got in the chat, and we will do our best to answer them as we go along. Some of them will just be sort of responded to in text, and some of them will respond to at the end verbally. If we have sort of hundreds of questions, then I will send round a note at the end and answer as many of them as I can. And so if you've got questions for specific speakers, if you could just put their name at the beginning, just so it makes it easier for us to direct them to those speakers. And that's great, thank you. So just back to the tool now. So the tool is a series of checklists, overarching and thematic, which we really hope will help local safeguarding partnerships or equivalent multi-agency groups to assess their response to missing children. So the tool, as Mark mentioned, really is a culmination of the Children's Society's long history of working with young people who go missing. So that's both in our direct practice, but also in our research and policy work. So it draws together our extensive knowledge base in this space, but predominantly brings in findings from our first step report that I'm going to talk to you about in a little bit more detail in a second, but just also really important to note that it brings together findings from the NWG, who've got extensive experience working with local areas to help them improve their response to missing and exploited children. And also a big thank you to the charity Missing People, who reviewed all of the items of the checklist and gave some really great feedback as well, so thank you. So just back to the first step report. In 2017, we were commissioned by the PCC in Norfolk and funded by the Home Office to carry out a piece of research which sought to build up a clearer picture of what return home interview provision was looking like across England and Wales. So the research was carried out over the course of about 9 months and comprised a national survey, deep dive in 5 local authority areas that spanned 4 police force sites across England and Wales, and focus groups with children and young people with experience of missing and return home interviews too. So we started off with the survey, and we really wanted that to help us build up a good picture of the sort of the scale of missing across the country and the response that those young people were getting. So we had 103 responses to this survey, and the survey was asking questions such as, how many young people going missing in your area? Where are they going missing from? Children's, are they going missing from home, missing from care, missing from out of area? How many of those young people get offered a return home interview? How many of them accept? How many actually take place? And what's the offer of follow-up support in your area? We also asked some slightly more strategic questions. So things like, do you have an up-to-date missing from home protocol? Do you share information in a multi-agency way? And based on the findings from this survey, we were able to identify some areas that looked like they were already working really well. And it's important to note that sort of the aim of this project was to highlight good practice. Whilst we obviously identified some things that hindered practice, we really wanted to show how local areas could sort of improve their response. So once we sort of identified those areas that were working well, we approached them and asked if we could come and do a sort of deep dive and sort of get a really good understanding of what it was they were doing that was supporting good practice group of children. So once we arrived in the areas, we did an analysis of local policies and procedures, interviews with a range of key stakeholders. And so these ranged from sort of children's homes managers to missing from home coordinators in the police and in the local authority, as well as front door managers. And we really sort of took the lead once we were there as to who to interview, and sort of interviewed up to around 20 to 30 people in each area. We also did a series of focus groups with practitioners delivering return home interviews and some case file analysis of return home interviews that had already taken place. We did separately some focus groups with children and young people who had experience of going missing, and these represented young people who'd been missing from home, missing from care, and within that care group, young people who'd been missing from out of area. So we took all of these findings together and analysed the data to build up a really clear picture of what was sort of helping and hindering practice in local areas. And as you can imagine, we gathered a load of really interesting data, and we were able to highlight a load of good practice examples that are happening across England as Wales, as well as making some really clear national policy recommendations. Now, the final report was about 100 pages long. And while it's something we're really proud of, and I will share it with everyone after this session, we sort of wanted to make it into something that was slightly easier for professionals to use on the ground. And we were also really keen to bring in sort of all of our experience into something that was slightly more sort of tangible. And that's why we came up with the idea of this tool that we're going to launch today. And it's how we came to work with NWG, as we thought it was really a good idea to sort of bring in all of their extensive knowledge as well. So as I mentioned, the tool is a series of 12 checklists, and these cover all of the stage of a young person's journey, from going missing to returning and to that offer of follow-up support. But it also addresses some slightly more procedural issues, such as information sharing, data collection, and the 72-hour timeframe. I'm just going to show you a short video now, and the video explains how to use the tool and what it looks like.
Hello attendees, please bear with us while we resolve this. Apologies attendees, we will get this resolved shortly. Hannah, you are muted.
Oh, sorry, it doesn't look like the video is going to work, which is a big shame, but I will make sure that I send it out to everyone after this. I'll just sort of give you a very brief description of what the video shows. So the video describes the fact that the tool is divided into 2 stages. So we've got this initial sort of self-assessment stage, which we ask you to approach in a multi-agency way. So in pilots, they've sort of invited about 6 to 8 people. That seems to have worked quite well. We've had representatives from local authority, the police, some sort of NHS staff, like looked after children's nurses and sexual health nurses. And the sort of point of that session is to come together and have a really sort of dynamic and holistic conversation about practice that's working across the area. And you're asked to rate yourself on a scale of 1 to 5 on the extent to which you meet a set of 26 criteria. So there's 26 questions that you have to answer as a group. Now, this stage takes about 1 to 2 hours if you sort of really have a good conversation about each point. And at the end, you're produced a tailored report. And now that report highlights which of the thematic checklists we think that you should address first. So as I mentioned previously, there are 12 checklists. So it might be that you are identified as needing to address information sharing and data first. And so whilst we strongly recommend that you do all 12 checklists over the course of perhaps a year, that initial stage just helps you identify which ones to do first. When you come to addressing the checklists look slightly different. They're divided into 3 stages. So you've got required actions. Now these are actions that are required by national guidance or other sort of police guidance. You've got good practice actions. So these are actions that we've identified in our research, as well as the knowledge from NWG and our extensive knowledge, as being items that improve practice but aren't necessarily in any guidance. The third stage are good practice actions that might require additional resourcing. And so again, these are evidence-based good practice actions, but actions that we appreciate might take a little bit more resources in terms of perhaps time or money. So each checklist looks like that, divided into your 3 stages, and you're asked to go through them again and again in a multi-agency group. Now, these groups might differ slightly to the group that you had at the beginning, and in the pilots, they've been setting up task and finish groups specifically for each item. So to give an example, if you're looking at return home interviews, it might be that you should bring in some of your return home interview providers, as well as other people from your safeguarding partnership, but you might not need those practitioners when you're looking at sort of data collection, for example. So it's about looking at the questions and looking at the checklist together and deciding in advance who's best to have in the room as you address those checklists. So these checklists are slightly different to the first stage, as they ask you to rate yourself on a scale of 1 to 5, and then also rate the extent to which you think that these actions are having an impact on your practice. And once you've sort of gone through all of these, you're able to see where the gaps in your practice are, and you're able to set actions as a group. And so in pilots, they've been setting sort of safeguarding partnership actions, but then actions for individual agencies as well. And so we would recommend that you would go away and start to implement these actions, and then meet again at a time that's suitable. I know that some of the pilot sites have set quarterly meetings to review the impact that these actions have had, but it's obviously sort of completely depending on capacity in each area. So that's sort of a brief summary of what's in the video. As I said, we strongly recommend that both stages are approached in a multi-agency way, and that you really do make an effort to approach all of the checklists, because whilst you might sort of come out of the first stage and it might look like, yes, you're sort of hitting all the criteria in certain of the thematic areas, the checklist is so detailed that it's very unlikely that you are meeting all of the points in that. So I think it really is worth just visiting all of the checklists. So the tool's been tested throughout the development process with an initial focus group of key stakeholders that enabled us to test some of our sort of like really early ideas and the basic structure, and sort of the aims of the tool. So after that initial focus group, we were able to sort of make some tweaks and start developing it into this online platform as it looks today. The sort of final version of the tool has been piloted in 12 different local authority areas, and that's been predominantly championed by local authority leaders, but in some areas it's been led by the police, and we're going to hear in about 20 minutes from someone from Northumbria Police Force who championed it across a number of local authorities in her police force area. So the pilots were really helpful and enabled us to make some quite substantial improvements to the tool. So we changed things like the scales we used, we changed the content and the way some of the questions were framed, and we were able to add that extra dimension that I just talked about, which was asking local areas to assess the impact that each action had as well. So some people here might have taken part in the pilot, so thank you so much for that. It's been really, really invaluable, and it's enabled us to really sort of streamline the tool, and I'm really proud of what we're launching today. So thanks so much for listening, and as I said at the beginning, please put any questions in the chat, but for now I'm going to hand over to Alex Bridge from Southend, and he's going to give his reflections on using the tool from a local authority perspective. Thank you.
Good morning, everyone. My name's Alex Bridge. I'm a service manager at Southend-on-Sea Borough Council. Within my role, I'm the lead for our early help service, our edge of care team, and also the operational lead for exploitation, which is a kind of like a really broad area of work, and within that becomes our missing children. Just to give a little bit of background about Southend, we're a unitary council, seaside town, 50 miles east of London. We get in excess of 400 children reported missing each year, resulting in kind of over 500 missing episodes. I know that some of you attending might be from large counties or shires, and those numbers probably pale into insignificance compared to you guys, but you know, for us, you know, it's still a daily activity, a daily task, and children are going missing every day, even from small boroughs like ours. I spoke about our response to exploitation. We, about 3 years ago, developed an adolescent intervention and prevention team, which is our frontline response to child exploitation. This is a multidisciplinary team where we take a top-to-toe approach to child exploitation and missing in all of its forms. We have a large staff team in this area. You know, we've got a group of youth workers who are out on the streets on a daily basis. We have early help staff who manage preventative cases on an early help level. We have social workers managing those on child in need, sin, and looked after children. And also what else we did is we pulled in our missing workers within the team, and we found it really valuable to have the missing staff sitting on the same team as the exploitation workers, just to have those conversations over the desks during the day. As well as the missing, we also undertake children missing education as well, and that sits with our 2 return to home missing practitioners. So we do the missing and children missing education. For our children who are looked after and placed out of our borough, we've just recently contracted a third-party provider to undertake all of our return to home interviews. I know a lot of people get a third-party provider to do it internally for the ones within your area, but we manage all of that internally. So when I was approached about this, I was really keen to undertake this pilot. Within my role, I am the chair of formerly the LSCB. It's now the Southend Safeguarding Panel. But I'm the chair of the Exploitation and Missing Subcommittee. Within that role, at times I found missing quite a challenging area to drill down on, to analyse, and to set KPIs for. You know, we've spent a lot of time building up our response to undertaking our return to home interviews. And, you know, some months, you know, it can differ very vastly from months, but, you know, some months we can hit 90–95% of our return to home interviews completed within the 3 days. Our quality assurance of these interviews is generally, you know, of a good standard. And that's probably, we didn't really move much further away from getting the return to home interviews done and the timeframes for that. And I really wanted to look at missing in a more holistic way, and I felt that maybe undertaking this tool would help us do that. So yeah, we just wanted to know what else there is to consider and how can we improve. So before we started the first self-assessment, we obviously spoke to Hannah and we spoke to Steve from the NWG about who might be useful to undertake the initial assessment, and who we decided in the end was me to chair the meeting. I had a frontline children's manager and a missing officer attend the meeting. I had the police missing persons liaison officer and I believe the police sergeant as well. I was really keen to have all 3 statutory partners in attendance. So we had a manager from our local UMS team, and actually from a comment that Alan Rees-Cooper made at a previous presentation about the amount of missing children from hospitals, we offer we got our hospital safeguarding lead to come and attend. It was really important that we, as well as choosing the roles, it was choosing people who would provoke conversation and some challenge in there. After completing it, it might have been useful as well for maybe our placement officers to attend, or maybe a manager from our looked after children's team or 16+ team. They might have been quite useful input coming into the conversation as well. But, you know, 5 to 8 people felt quite a comfortable number of people to undertake the assessment. I kind of think that if you're going 10+, you're probably never going to wrestle past each question, and anything lower than that, probably not getting enough opinions. So our experience of undertaking the self-assessment, it took us just over 90 minutes. We allowed 2 hours for the meeting. The tool was really easy to use. I logged in, questions came up, I read them out, we had discussions, and we logged through our answers. We were really keen when undertaking this tool that it had an impact on children and on service delivery. That was one of our real motivators in doing this. And we wanted some honesty in the room. You know, it's very easy to try and complete a self-assessment tool or a matrix and try and get your best score that you can do, but that wasn't useful in this. We've not completed it as a tool to show Ofsted or write a report on and send out to partners to say how much of a great job we're doing it. We've actually took a philosophy that actually any discussion about any question, we'd mark it down on the lower edge, because that would mean that we'll do a deep dive self-assessment in it. And that's the kind of provision that we took because we just really wanted to improve our services. After we completed it, almost instantly, we received a RAG rated report. So the tool, the deep dives are split into 12 separate areas, and each of those 12 areas had a RAG rating. So that allowed us to sequence how we undertook the deep dives in each of the 12 areas. Before we even completed the deep dives or started it, we had another meeting on the back of the first assessment tool where we had some reflections, and you know, we had a massive list of things that we could do to improve our response. But these were some of the initial reflections. I'm not going to list them all, but you know, did we have the right data? How could we collect our data better? There was a lot of as you're going through the tool, it kind of talks about who completes the return to home interviews for looked after children in your area, and do you receive the information from that? And you know, we kind of, like a lot of local authorities, we stick to the statutory part that we do, and we've kind of reflected that maybe we don't collect all the numbers of the children looked after in our area who go missing within Southend, and we probably don't look at all of the intelligence that could be gained by looking at the return to home interviews completed for children placed within Southend. So that was something for us to consider moving forward. We also talked about how we could work better with our children's homes, supported housing providers and our foster carers, whether we could improve our training to all these people, whether we do quarterly meetings, maybe some discussion forums about missing children, local trends, and any training that could be done with all these providers. We had a conversation about our procedures, particularly around our where you go to undertake a return to home interview and you don't receive consent from the parents for it to be undertaken. So it kind of made us consider, actually, you know, what are we doing in those circumstances? Are we just not doing it, or do we need to write kind of a real clear procedure about what we do and any escalation from that? It made us think about our hotspot locations regarding missing children, either where they go missing from or where they go missing too whilst they're away. And I suppose the overriding factor was our response to missing needs to be far wider than just our basic statutory responsibilities. So how we intend to use it moving forward. So we made a priority list of deep dive areas. And the way that we've decided to take this on is to do a deep dive, build an action plan off of that deep dive, and then once all the actions are completed, that will then move on to the next deep dive. I was a bit concerned about doing one deep dive straight after another and ending up with a huge action plan list that was not manageable. So our bit was, right, we're going to do the first one, make an action plan, tick them all off, then start the next one. We are going to put the responsibility of the actions and the undertaking and coordinating the deep dive through our operational missing and sexual exploitation group, and this is going to be governed by the LSCB exploitation and missing subgroup, so we've got some oversight on it from the partnership. I'm just going to talk you through quickly our experience of a deep dive. We first of all looked at data. We felt this was a really good place to start about understanding our data, and yeah, it kind of felt like a position to make sense to start with. As Hannah rightly pointed out, each deep dive is going to require different partners. So, you know, for our deep dive into data, this is mostly looking at council, local authority data and police data. So we had the police, our data team, we had our ICT alongside our missing practitioners on this one. This took less than 45 minutes. We've got an action plan on the back of it. And what I thought might be useful to show you kind of how it works in reality was to kind of show you some of our actions from one deep dive. As you can see, there's a lot on the list, and this is why we didn't want to smash out deep dive after deep dive, because our action plan list would be very large. But I'm going to run through some of these just to show about some of the tangible results that we got from using this tool. So our return to home form needs to be changed on the system to include information like type of placement, so we can break down where our missing children come from, whether they're coming from home, whether they're coming from care placements. Also, the risks experienced by children, and also when referrals are needed on the back of it. So basically, we have, like many agencies out there and teams, we have all that information within our documents at the moment, but it's all in text and we can't sift it out. So by changing the form and thinking about using radio buttons, we can then be able to pull out the data that we've already got, but in a much better way. And we also wanted to break down the way and the reasoning for refusals of return to home interviews. We wanted to produce physical maps of missing from locations and found locations so that we could start analysing patterns. We need to amend our dashboard. We have a dashboard for missing at the moment, but you know, if we're making these changes, we're going to need to expand that on the back of this deep dive. Apologies, scratchy throat. We need a way of recording where out of area lack children placed in Southend have their return to home interviews recorded on our system, and how we can withdraw figures from that. We also need to start recording data by setting. We spoke about multiple missing episodes. So often, maybe with the more frequent missing children, they might go missing 2 or 3 episodes before you manage to undertake your return to home interview, because they might get home half an hour later, they're out the door again. But we really needed to make sure that where you've done an interview that covers multiple episodes, how we separate the needs and the risks from each episode off separately, and also the different found locations, because each one is an episode in its own right. We also thought it'd be quite interesting to try and report on the number of strategy meetings undertaken due to missing episodes. The police also managed to get some actions on the back of this. So the police will be looking at hotspots, mapping of known hotspots where children go missing from and to, and that's going to include the out of area data. As many of you may know, Southend is within Essex, so we've got a big county, Essex, neighbouring us, and Thurrock on the other side, but obviously the police cover all 3 local authorities. So we spoke about getting the return to home interview and safe and well information, especially from our partners in Essex. We spoke about how the police recorded hazard information on their systems about children, and about how we can maybe transfer that over to our children's services systems, and particularly those from out of area who we don't have the direct oversight on. Completing this, I've kind of put a statement at the bottom here. Completion of this deep dive has given us a far better idea of what data we should or could be collecting, and how it could be analysed and used moving forward to analyse our missing more strategically. I think my time is coming to an end here, but I've got a few ending remarks. So, you know, obviously this tool's provided us an ability to ask questions for ourselves that we'd previously not considered. And for me, as the chair of the safeguarding, exploitation and missing subgroup, it's acted as like a well-needed critical friend. Now I've got agenda items probably for 2 years moving forward. For my subgroup on missing, where before I kind of felt like I was scratching around a bit about what to talk about, what to analyse, what to do. I do have a genuine belief that the outcomes and the actions that we're putting in place on the back of completing this will have a benefit to children, will allow children to be safeguarded better, will provide better information to the police to allow them to find children better, and it will enable us to have a stronger partnership, you know, especially when we're working with our care placement supported housing providers a lot stronger. I'd like to kind of end this bit just to thank Steve Bagley from the NWG and Hannah from the Children's Society for the opportunity to undertake this pilot. And I'll cancel my screen now. Okay, I'll have a quick look in the QAs, and if not, I will hand it over. Okay, what I'll do is I'll take any questions and answers at the end of the session, but now I'll hand over to Lynn College from Northumbria Police.
Hello everyone, my name's Lynn College. I'm a detective inspector from Northumbria Police. Have to apologise, I've had some camera issues this morning, so you would have seen me, but unfortunately now you've just got a screen. Had I known, I would have prepared some slides in advance, so apologies you're looking at my name for the next kind of 15 minutes or so. Just to give you a kind of police perspective on using the benchmarking tool. So in relation to Northumbria Police, we're up obviously in the northeast. We cover Northumberland and Tyne and Wear. We've got the urban areas of Newcastle and Sunderland, busy city centres with lots of missing episodes, and then the more rural Northumberland area. And our police force area is split into 3 area commands. We've got North, Central and Southern. My role within Northumbria at the minute is in our safeguarding department, and I've got the lead in relation to improving our response to missing. As a force, we've got a high number of missing episodes. To give you some context, in 2020 we had 6,215 missing children reports, and that was a split between 53% looked after children and 47% non-looked after children. Obviously we see some disparity between our local authority areas and their kind of demographic. So in the city centre areas, we have high numbers of missing children. In some of our more coastal towns, not so many missing children. So in terms of me having the missing improvement plan for the force, very much recognise that it's not about demand reduction in relation to missing. It's very much about understanding that behind every single missing episode there's potentially a vulnerable child there, and looking at what we can do with our partners to prevent some of those missing episodes. In June 2020, we recruited some additional missing from home coordinators into force, and their role is very much around problem solving with partners to try and prevent missing episodes and prevent repeat missing episodes. And it's recognised, we all need to work together as a partnership to achieve that. Our force area covers 6 local authority areas. So we've got Northumberland, Newcastle, North Tyneside, Gateshead, Sunderland and South Tyneside, and again very different local authority areas in terms of makeup, and they all have different priorities and different approaches to missing. Some are more focused on contextual safeguarding than others. They have different challenges. Newcastle, as a city centre, has had missing children involved in county lines and criminal exploitation, and we've recovered children from other parts of the UK. Other local authority areas are wrangling with different challenges around their missing children. So when I first heard about the benchmarking tool, I was very keen that we looked at that in Northumbria as part of improving our partnership response. I've done a lot of bits of work with the business managers within the 6 local authority areas, and we've got a good working relationship, and there's a lot of trust there in relation to our working relationship. So I approached the 6 local authority areas with a proposal that across the force area, I wanted to do the benchmarking tool to look at where Northumbria were, what our force response looked like, and also to try and get a bit of collective activity around the 6 local authorities and missing. I also chair some of the strategic exploitation groups within the Northumbria force area, and again recognise that similar to Southend, that there were some issues within those groups around data and information sharing across boundaries, and I was keen to try and pull together some of the localised work into more of a regional approach. So in terms of our force and where we decided to run the benchmarking tool, we hold a monthly what we call our MSET meeting, which is around, again, missing, slavery, exploited and trafficked children. That deals with our highest risk cases in respect of missing and exploitation, and I chair a number of those groups. So the proposal to the local authority business, the Safeguarding Partnership business managers, was that we benchmark the tool and do the question set within our MSET meeting. That's a monthly meeting. We've got a really good representation from a range of agencies. We've got social care, youth justice, health, sexual health, our local care home providers, education, mental health support, drug and alcohol support, and then we've also got support from the charities who are commissioned to do the return home interviews, and also some more localised charities who are doing some great work around mentoring in relation to exploited children. So the initial stage of the benchmarking tool, we did that within the monthly MSET meeting. I chair that meeting, and I volunteered to facilitate the discussions around the first stage of the benchmarking tool. Partners had the opportunity to remain for that, or equally, if they felt that they didn't have a contribution to make in relation to the first stage, they were welcome to kind of leave the meeting. We got a good representation at the first stage in terms of having those healthy discussions around missing, and it was really useful to have charities perspective, to have an education perspective, and again to have perspective from health. So we did that across 4 out of our 6 local authority areas. We engaged 4 of the partnerships to take part. And that was a really useful exercise from a police perspective, because it was good for us to test whether there were similar areas to improve across different local authority areas. And there were. It identified for us the quality of our prevention interviews in relation to missing episodes could be improved, and also some of the culture and the thinking around repeat missing and the vulnerability of repeat missing children also needed to be looked at. And that was really useful for me to be able to then look at what our training around missing children needed to look like for our frontline officers. So after the first stage, again, that took initially probably 1 to 2 hours. And then we arranged a follow-up meeting to look at deep dive in some of the themes. It was interesting that different local authority areas, obviously they were all RAG rated in relation to the themes, and different local authority areas came out in red in different areas. So it was good for us to be able to explore different themes with different local authority areas. Different local authority areas and partnerships chose to approach the second stage in different ways. One area was already looking at their response to return home interviews and how they conducted those return home interviews. So they were keen to use the tool to explore that area in greater detail and do some deep dive into their response to return home interviews. And again, the question set was a really good way of having that healthy discussion around that area. Another area had 3 themes, 3 checklists that they wanted to look at, and they decided to do all of those in one meeting at one time, with one overarching action plan that fell out of that. And another decided that they were going to kind of make it in more manageable chunks, and they've took a theme at a time and going to progress those over a longer period of time. So in terms of the RAG rating, like I say, the different local authority areas had different areas that came out, and it was good for us to be able to see across the board what that looked like. Our action plans, again, similar to Southend, are going to be managed through some of the exploitation groups through the partnerships. We're keen again to capture all the discussions that took place. So because we had a minute taker for the MSET meeting, we managed to get the minutes of the first stage of the checklist, and that was really useful because there was a lot of healthy discussion and a lot of really good ideas fell out of that first stage of doing the benchmarking tool. And we also made sure that we captured all the discussions from the more in-depth deep dive into the specific themes, and that helped us. You know, the action plan almost fell out itself in relation to the areas that we needed to look at and explore. We're still working through that now. We started the process in October, and we're still working through some of the task and finish groups with some of the local authority areas. I would hope that moving on from there, the plan is to look at a refresh of our regional joint missing children protocol and try to ensure that we've got the best possible regional missing protocol in relation to children. One particular area that fell out that was really useful for us was around how we share information across our boundaries within the 3 area commands. Again, they're quite internalised, and it was apparent that there was occasions where children were going missing from Gateshead, for example, and turning up and being found in Northumberland, and we weren't necessarily at that point in time joining up between all of the coordinators across the different area commands and sharing information around disruption opportunities, around locations, around any particular hotspots. So it was really useful to pull out that bit of work straight away, and again to identify where we as a partnership had gaps in our data capture and how we needed to get together and explore where we could potentially strengthen our data share and our data capture, again to kind of highlight those perpetrators, those themes, those hotspots in relation to missing. I think the best thing for me around the tool was the kind of credibility. You know, it was written by the Children's Society and NWG, and I think that gave the partners a lot of confidence that this wasn't something that was police led or police suggested or police imposing on partners what we thought should happen. It was there was credibility there because it was actually came from Children's Society and NWG. Lots of the areas in relation to suggested activity, what good looks like and what good would look like with additional funding and resources. Not all achievable for all local authority areas, but always a really good just kind of start point in terms of thinking around missing and response to missing. So yeah, a really useful exercise for us, and one that's not over with, but a one that I'm sure when we get to the end of the process will confidently put us as a police force in a much better place in terms of our response to missing children. Probably rattle through that really quickly. I'm a typical Georgian, I speak quite fast. Question wise, I'm not sure if any questions have come up in the box there. I'll just check. Yeah, lots of comments in there. I'm not sure there's any questions at the minute. But again, as the previous speaker said, I'm happy to take any questions. I'll be here till the end. And again, apologies again that I've got camera difficulties. Thank you.
Thank you, Lynn. We're now going to hear from Sheila from the NWG with some reflections from the NWG Network's perspective.
Sheila, please turn your camera on.
Hello, sorry about that. My internet glitched for a moment there. What a fascinating morning I think today has been. And I just want to thank everybody, the Children's Society in particular, Hannah and Arena, who've worked so hard at making sure this tool and the development happens, along with our own Steve. Their commitment to this tool has been commendable, and I thank them all immensely for that work. We'd particularly like to thank the pilot areas who provided such valuable feedback to inform its development. Without testing it on the ground, you can't make sure that it works really well and find the glitches. And as you've heard from Alex and Lynn today, who've presented, the feedback from the pilot areas covering the perceptions of both social care and policing perspectives, covering both urban and rural areas, it's a very positive reaction, and that the tool acts as a critical friend and asks you questions that you perhaps don't always ask yourselves. And like all assessment tools, it will only be as good as the honesty that goes into the discussions and the gradings. Dipping into just parts of the tool will not give you the overall support it's been developed for. And the pilot areas, as Hannah and Steve observed, certainly created some robust, open and challenging discussions which identified some key actions to further enhance local missing responses. And for those reasons alone, I would encourage all local strategic partnership missing groups to use the tool and go through this process. If you've got any questions or queries or feedback about the tool, there are 2 email addresses from the Children's Society and the NWG that you can use, and they'll be more than happy to work with you to see how we can still carry on and improve our responses to children and young people. You can sign up to the NWG as a free member to access many of our resources that the NWG host in support of work in tackling the issues of all aspects of child exploitation, including the missing agenda, and take advantage of the different forums that you're able to join. I know Hannah and her team have also put a range of resources together that might help. When a child goes missing, it is important to recognise that there is something wrong. The missing incident is likely to be a symptom of a cause. Being professionally curious about the cause when responding to missing episodes is vital in how we safeguard and support children and young people. As with both the Children's Society and NWG, our focus is always the ultimate beneficiary. Therefore, this Missing Children's Response self-assessment tool is designed to support the enhancement of local responses, challenging ourselves to see if we can improve our responses and ultimately assist vulnerable children and young people to reach their full potential. Thank you so much for everybody joining in and helping with this. And I thank you immensely for the work that's gone into it on behalf of those children and young people who will benefit from it.
Brilliant. Thank you so much, Sheila. I'm just going to put Alex back live, and he's going to address some of the questions in the chat. I know Alex has been sort of answering progressively through just in the sort of text chat, but I think it would be great to hear from you, Alex, just a little bit of a summary of what you've responded to so far and sum up your experience. Thank you.
Yeah, so I've had, I'm just going to go flicking through the questions now. So I've had a question about, does the tool support consideration of the impact, risks and challenges presented through COVID? So there are no COVID specific questions, but what my thinking on it is, because we've kind of started to change our data, is where we've switched our data about now, we've got a much better hold on the impact of COVID by looking at the data over this period compared to the period the year before. So the tool's not COVID specific, but you know, you can, the outcomes from doing the actions from the data will provide you with some patterns through COVID through that way. I've got a question about does the police response depend on the length of time a young person is missing and their vulnerability? Obviously it does to a degree. I can only speak for my local police force, but every child in Essex is graded as a minimum of medium risk, and every missing child does get a police response. I've got a couple of people asking for meetings, which is fine. We're asked, do we routinely share information from our return to home interviews with police? So we do. So our missing officers and our missing people liaison officers every fortnight have a meeting, and we go through and data match every single missing child in that period. We then do intel swaps of the safe and well checks and the return to home interviews. And that was something that came up during the assessment tool as well. Hannah, is there any other particular questions that you saw that you wanted me to answer?
I think that covers most of it. There are a couple of questions about your MACE structure.
Oh, yeah, OK. So in regards to our MACE, obviously Southend separate from Essex, we had we stopped using MACE for a period in time, and we brought a new meeting together, and an operational one looking at child exploitation, particularly county lines, because we had an operation going on at that time. And a lot of that work was absorbed into the specialist exploitation team. We were quite fortunate in Southend, where we've got specific CSE police officers, we've got specific county lines police officers, and the MPLO, who kind of work within the team to a degree. So, you know, a lot of the cases were managed within the team and existing structures. We are rolling out a new MACE from this bit, just so we can take a bit more of a holistic look at particularly our missing patterns, as opposed to dealing with it on a case-by-case basis, and our CSE as well. Is there any other one? Oh, I had one other question here about the KPIs as well, about what else we're looking to measure apart from the 72 hours of them getting completed. What we really want to measure is to start looking at outcomes, seeing if our work then can reduce the duration of missing periods, can make an impact and disrupt any particular areas, either hotspots where children go missing to, and try and reduce repeat missing episodes. I think that's most of them I can see. Hannah?
We just got a couple of questions, Alex. One is around how you approach the issue of consent from sharing information from return home interviews, and another question about young people who are placed out of area and how you address that issue in Southend.
So originally the young people placed out of area, we don't have large numbers of young people placed out of area, I'm quite pleased to say. Originally, the social workers were responsible for making a response for this. However, some of the return to home interviews were coming back in not the greatest timescales and not all to the best quality. So what we've recently done is we've commissioned a third-party company to undertake return to home missing interviews for all of our looked after children out of borough. Also what we've done is we've expanded, obviously we neighbour with Essex, we've expanded our radius where our return to home interviews are undertaken. So we're not just doing them within borough now, we're kind of pushing our areas out to try and look after our undertake them directly of our looked after children in placed in neighbouring authorities.
Brilliant, thanks, Alex. And just one final question, and any more questions we will answer in a sort of roundup email afterwards. I know this is something that you talk quite a lot about, Alex. The question is, when do you count the 72 hours from the time that the child is reported missing or from when the interview is offered?
So the 72 hours is from the found time. So the time the child's found, and then we get a police compact sent to us. That's when our timer starts going. So yeah, it's from the point of found.
Brilliant, thank you, Alex. We've just got one question for you, Lynn, and that is just around who in your police force analyses the information obtained from the return home interviews. And I guess it would be just quite interesting to hear what kind of content you get and whether it's useful for you.
Yeah, it is useful in terms of identifying hotspots, and that's captured by a performance analyst within our kind of Central Force Intelligence Bureau, alongside capturing our kind of exploitation data as well. Moving forward, I think we're looking at how we can get a better multi-agency data set as indicators of missing and exploitation, and that's something we'll be exploring through the strategic exploitation groups this year.
Right, thank you so much for everyone joining today. It's been really, really great to hear from the perspective of the police and the perspective from the local authority, and it's just really great to launch the tool and have so many of you here today. Quite a few people have been in touch just to say could they have copies of the slides, and obviously we had the issue with the video, so I just wanted to say that after this event I'm going to share with you Alex's slides. I'm going to share the explainer video. I'm going to share an information sheet that I have put together, as well as a link to the tool itself. So we're just really, really keen for you to start using it in your local areas. So if you do have any questions about how you can start using it and that you don't feel are answered after the video and the information sheet, please feel free to get in touch with me directly. And I will respond, and I'll obviously put my email in that in the mail out to you all afterwards. So thank you so much for joining, everyone. Really, really, really great to see so much interest, and thank you so much to Alex and Lynn and to Sheila.